Imagine going through this holiday season with more energy, better relationships with family and friends, and an overall feeling of enjoying and regaining your life. Well, all that can be possible with the help of hormone replacement therapy. And joining me this morning is Dr. Gary Donovitz. He's the president and medical director of BioT Medical, which was formerly known as Sotapelli, Texas. And with him, Dr. Lisa Gardner, the founder of Fusion Women's Health and Wellness over in Fort Worth. Good morning to both of you.
Good morning. Good morning.
We want to feel better. We want to feel good this holiday season, better relationships. I think you're speaking to everyone when you say that, Gary.
I am. And by the way, how are you doing on your journey?
Yeah.
You know, we pelleted you now, what, 5 weeks ago?
Yes.
6 weeks?
Yeah. Was it that long ago? Yeah, good. So we're talking about this today because a lot of people don't realize that in your 30s that you're a good candidate for bioidentical hormones. So I did this a month or two ago, as you said. I'm feeling good. I'm feeling really good. And a lot of people may not realize that their hormones change as they get older, and they're a good candidate for this too.
Well, that's right. Both men and women, as they age, start losing their hormones, particularly testosterone. Women in the late 20s, early 30s, guys in the mid-30s. They can't function as well. They're tired all the time. They don't sleep. Sex drive is down. Gaining weight around the midsection. That's not so good after the holidays either. And they find out they're moody, they're irritable, depressed. Things are not going well.
Okay, Dr. Gardner, I want you to chime in on this because you've had some amazing results with your patients, and I really want to hone in on who's a good candidate for this, because I didn't think in my 30s I was. You don't think about this so early in life, but maybe we should be.
Absolutely. As a gynecologist, you can also see men in your practice, which is a really big thing to say because we think we can't see gentlemen, but we're also seeing our patients' husbands as well, so we can do a combination therapy.
Is that often because the wife has had such success with the therapy?
Absolutely.
And she says, hey, maybe you should come on in and get your testosterone checked?
Absolutely. And I had mine placed about the same time as you did, about 5 weeks ago, and it changed my life. Absolutely. In about 4 days, I noticed a difference. And my patients are noticing even within 24 hours a difference. I pelleted one of my dear friends yesterday, and she texted me last night and told me that she noticed by the end of the day.
Oh my gosh.
So the energy levels, the libido, everything is improving within about a week.
It's like a 24-hour miracle lift. Okay, I really want you to break this down because this story really hits home for so many people. Tell the story of the twins. It's Carol and Ann, right?
It's Carol and Ann.
Yes,
they were
Carol
twins. I'm just going to throw all this out here.
Look at all this.
This is the way people have lived their lives. Carol was in her 30s, had her kids, wasn't feeling right. She was tired, she was irritable, she was gaining weight. She went to the doctor, she gets put on antidepressants. That didn't make her feel better. In fact, it made her feel worse. She had no energy, she got some more antidepressants. Now she's 40 years old, she's overweight, she gets put on diet pills, goes on fad diets, finds out her cholesterol is out of whack, gets put on more pills, now she's on cholesterol medicines. Finally, she stops having her periods and she's 50 years old. What does she get put on? Horse estrogen now. That didn't work, so let's go to some creams and rub those on. She can't sleep because she's having hot flashes, and here's some sleeping pills for you. And by the way, now your bones are soft because you got osteoporosis, so you need some more medicines and some more medicines for your heart. And this is her bag that she carries around in her purse. And that's really what Carol had. Now, Ann, on the other side, which her twin sister, had the same symptoms at 30. But she went and got her hormones checked. She gets put on a few bioidentical hormone pellets subcutaneously like we do, and their pictures at age 60 are completely different. I think you'll have a picture of them.
Yeah, we did. And okay, that's motivation, again, to anybody to think about maybe seeking treatment. So the first thing to do is to find a location that does the BioT certified practitioners, and they can instill this, like yourself, Dr. Gardner, and change some people's lives today. That's
right.
High five, Doctor. It's really good stuff. All right, you can call this number. It's easy, 877-99-BIOT, 877-992-4683. And you can also give Dr. Donovitz a call, 817-467-7474. And to reach Dr. Gardner, 817-644-1758. All this information and more is at biotmedical.com.